Hello, everyone. My name is Ufoma Uyibara, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar. Today's webinar is the first in a three-part webinar series titled Virtual Tools for Schools and SBHCs During the Pandemic. Today's presentation is a SBHC provider and school partner focused webinar on 3 different video games that teach risk reduction and HIV prevention, personal health advocacy, and smoking vaping prevention. Please note that all attendees will be muted upon joining the session, and we ask that you remain muted during the presentation. There will be a question and answer session at the end, and we want to hear your questions then. At that time, you can use the chat icon that appears at the bottom of your Zoom control panel to ask questions, or use the microphone button to unmute and ask your questions verbally. Please also note that this session is being recorded and participants will receive a copy of the slides after the webinar. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students typically spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. During the pandemic, we've learned a lot about schools being closed in a variety of ways and different barriers to access for school-based providers. However, we strongly believe that school-based healthcare is more than just the facility or physical space it exists in. It comprises a network of relationships, history of collaboration, systems of communication, and formal agreements that continue to expedite access and service provision to young people, even if the building is closed. Our webinar today will be facilitated by Katie Stinchfield, Senior Program Manager focused on behavioral health initiatives at the School-Based Health Alliance. Our speaker today is Tyra Pendergrass Boomer from the Play to Prevent Lab at the Yale School of Medicine. Tyra brings a diverse educational background and unique work experience to the Play to Prevent team. She received her Bachelor of Science in Biology from Howard University and her Master's of Environmental Management from Yale University. In her capacity as Associate Director for the Play to Prevent Lab at the Yale Center of Health and Learning Games, Tyra is instrumental in building and maintaining community partnerships, overseeing day-to-day operations of the lab, and presenting the lab's research in local, national, and international settings. Tyra is a 2013 Connecticut Health Foundation Health Leader Fellow. She is also a 2018-2019 Advanced Health Science Research Fellow at the Yale School of Medicine.
Thank you so much, Ufoma. I want to welcome everyone and thank you for joining us today. I'm going to go over our objectives and then pass it off to Tyra. So our goals today are to learn more about the Play to Prevent Lab at the Yale Center for Health and Learning Games, who they are, what they do. We'll learn specifically about 3 of their existing games, Play Forward, Smokescreen, and Playtest. We'll learn how to access those games for free. And we'll engage in an interactive Q&A session with peers to discuss some implementation ideas. And just a heads up, we will ask you to turn your videos on for that that portion. So prepare yourself. And we'll also learn about some upcoming opportunities with the School-Based Health Alliance and Play to Prevent, including how you can get involved in video game development. So I want to start off, I'll pass it to Tyra now, and she'll share a video about the Play to Prevent Lab.
Yes, so thanks, Katie. So it is my goal today, like Katie said in our introductions, to introduce you to the Play to Prevent Lab and what it is that we exactly do. And we are unconventional in many aspects of being a research lab, in that we develop video games. And a lot of these things that we'll go through in the webinar today, I can show you better than I can tell you. So to begin, we will play this introduction video that will give you everything P2P.
At Play to Prevent, our video games are built by teens and young adults, for teens and young adults, to help them live happier. At Play to Prevent, our video games are built by teens and young adults, for teens and young adults, to help them live happier and healthier lives. Their voices, their stories, their visions, that's where the games are built from. It is really a collective brain, not work that can be done by any one person or any one of us. It is students, teachers, game developers, scientists. For the development of our video game interventions, everybody brings their expertise.
Community partners can range anywhere from after-school programs to schools. We always start off with focus groups with our students. From that information, we're actually able to glean what information should go into the game, storylines that will be relevant to the kids. It helps us develop different characters that might be in the game.
The greatest part about what we do is having kids design and be involved from the bottom up. But they really kind of form a lot of the stories and the narrative.
We'll take the game to our game developers, we'll build out a prototype, we'll take it back to our students and say, is this relatable? Does this work?
So we're passing out headphones so you guys can be totally immersed in the game. During the gameplay sessions, we observe their reactions to the game. They're having trouble on different levels.
When they play test, they provide feedback on what worked, what didn't work. Teens love being honest and love sharing their opinions.
I like the strategy and the competition.
In this game, you really don't have that much of a penalty, but in real life, you could lose a job, you could lose friends.
The only way that an intervention is going to have impact and meaning is if it is from their voice. A critical part of this work is being able to measure the impact. We conduct randomized controlled trials, the gold standard, and we've been able to demonstrate that our games have statistically significant impact on different outcomes that we're looking to measure. So in the short term, we're continuing to build our evidence. In the long term, the key is to really get these games out.
My apologies, just a second.
A lot of the story.
So we're passing headphones so you guys can be totally.
Play test, they provide feedback on what worked, what didn't work. Teens love being honest and love sharing their opinions.
I like the strategy and the competition.
In this game, you really don't have that much of a penalty, but in real life, you could lose a job, you could lose friends.
The only way that an intervention is going to have impact and meaning is if it is from their voice. A critical part of this work is being able to measure the impact. We conduct randomized controlled trials, the gold standard, and we've been able to demonstrate that our games have statistically significant impact on different outcomes that we're looking to measure. So in the short term, we're continuing to build our evidence. In the long term, the key is to really get these games out broadly.
Great, thanks for that, Katie. So with that introduction video, you kind of see just like a broad strokes view of like what we do at the Play to Prevent Lab. And one of the things that I always try to do when I'm introducing the lab is to step back a little bit and explain how we actually got here. So the Play to Prevent Lab has been in existence for 12 years now. And how we actually came about is that in 2009, the National Institutes of Child Health and Development put out a request for proposals where the request was using proven factors in risk prevention to promote a promotion from HIV transmission. And our PI, Dr. Lynn Feline at the time, she always says that she had about 5 kids in her house between her and her husband that were on some type of electronic device. And so a grant was put in to utilize a video game to actually have a significant impact on this HIV transmission rate amongst young people. So because this was our first game, we were starting from scratch. Like, how do you actually build a video game that's going to be effective and do what you want it to say, do what it said, what you say it's going to do? So right here on the screen, we have an example of a party scene picture where we actually took this to teens who are an integral part of all of the games that we build, because if we're building an intervention for them, it has to have their voice in it. So we come up with a variety of ways to elicit their voices. And so with this party scene picture, we would take it to different focus groups and we would ask the students, like, what's going on here? And it would be so interesting to hear their thoughts and their perspectives about what they thought was happening in this picture. So for example, like, you know, as an adult, we may look at it and see, like, you know, the very on the surface things like, okay, the guy in the forefront, he's smoking, he's on a cell phone, these girls in the back, they're kind of whispering. Well, the kids actually picked up on some stuff that was happening way back in the scene. If you see the guy in the pinkish shirt with the girl in the yellow shirt, and she's looking at her watch, and the kids interpreted that as the girl was late, meaning that she was pregnant. And so it was those kind of things that the kids were able to pick out of this party scene that we were able to further have conversations about. So we also gave them the task of getting them to think about their future. So a lot of our games are geared towards middle school and high school students. And the reason why we target middle and high school students is that we think that it is important to give them the skills and knowledge necessary beforehand, before they actually start encountering certain risky situations or certain health behaviors, to try to implement that before they actually encounter those. And so that they can build the skills necessary so that when they actually get older and actually do need them, it's a lot easier to kind of shape a kid that way than to try to correct it after the fact. So in order to get them to think about, you know, the future, we had them do this particular project, the My Life Timeline, where we had them put their current age. So we can see with this particular picture, this student was 11 years old, and we told them to extend it all the way out until they were like 21. And we can see kind of from, like, you know, what they put on here, that they had some very lofty goals, but then also some very childlike goals. Of course, they wanted to graduate, they said at 13, so I assume that meant middle school. They wanted to get a job at 15. They wanted to get their driver's license at 17. And then they wanted to open a hair salon at 18. But then if you fast forward to like 20 years old, they want to help out their mom in some capacity. And so we thought it was really important in our first game to have an element of this future orientation when we're getting kids, again, to think about how decisions that they make at this point in their life can actually affect their future. And this timeline project actually helped us to do that and get some content that we wanted to put in the game that was relevant and relatable to the kids. Another project that we actually had them do was the poster project, which was geared towards message framing and how we would actually present these messages to them in the game. So again, remember this first game was specifically about preventing HIV in young adults. And so we were not sure, like, okay, do students this age respond to kind of like the finger wagging, like, don't do this because this could happen? Or do they respond to kind of the antithesis of that, which is like, oh, maybe you should do this over here because this has positive outcomes and effects, and that negates this bad stuff over here. So what we were actually able to tell from this poster project, this message framing, is that it had to be a combination of both of them. Of course, like, middle school, early high school students, no one wants their finger wagged at them, but it is important to give them that information about how certain behaviors that are not so safe and risky could actually negatively impact them at this current age and in the future. But then it's also good to present it from a positive spin as well. And so we can see here from this poster, this person was trying to get a message across about cigarettes. So, the first thing they have up there is like Superwoman that's in the hospital bed, and she looks like she's on her last lifeline. And that's kind of like the negative message framing, like, don't do cigarettes, like they can have like this outcome. But then also, if you look directly below that, the message is make good choices. Hey, if you decide not to use cigarettes, then you could do something great, like graduate high school. So we were able to elicit from the students, specifically how we wanted to frame the messages in the game. And then one of my favorite parts, we actually had a photo feedback project that was included with this first game, where we gave the students disposable cameras, old school disposable cameras, and told them to just gave them the simple instructions: go take pictures of things that are important in your life, whether it's your neighborhood, your friends, your school, the way you dress, different things like that. And so we can see from this slide here, these are some of the actual pictures that we got back from the students. And then we were able to translate those into actual graphics in the game. So you can see how those made the transformation. So as we continue on our game development journey, it is a very big iterative process of going back and forth between us, which is the Play to Prevent Lab, the teens, and we work with game developers. We outsource all of our coding and kind of graphic design to game developers. With this particular project, Shell Games is out of Pittsburgh, Pennsylvania, and they're associated with Carnegie Mellon. They were our game development partners for this first game. And so as you can see, if you start in the bottom left-hand corner at pass 00 and go all the way counterclockwise to pass 04, this is a classroom scene that appears in the game, and it went through so many iterations of the game developers coming up with ideas, us taking it back to the teens giving us feedback like, no, this isn't how my classroom looks, this is what you need to change. And so it is a very involved and iterative process, and again, it includes teens and their voices every step of the way. And this is another example of teen feedback that we got. Of course, with the game, we want to make sure that we have relevant and relatable characters as well as storylines. So these are some of the first passes that our game developers came up with, and teens are brutally honest. And so they came back and said, nope, the first girl, her clothes are too kids-like. The guy in the middle, he looks too old. He can't possibly be a teenager. And then, dress changes. So, we went in with it, giving some of the kids baggy pants, and they're like, no one wears baggy pants anymore. It's all about skinny jeans. So the kids were really instrumental in helping us to narrow down how the characters would look in the specific storylines. And then all of that was wrapped up into a nice game, our first game, Play Forward, Elm City Stories, which we'll talk a little bit more about in the upcoming slides. And this is actual screenshot of the home screen of Play Forward. So again, this was our first game. It has over 16 hours of gameplay. And you can see that the kids start, they actually get to build their own avatar. So you see down in the bottom left-hand corner, this person chose this particular avatar and named her Lulu. And the kids go through a series of storylines from 7th through 12th grade. So just like in real life, the things that they encounter may be based upon like what grade they're playing in the particular game. So like 7th grade starts with something as small as like you're in English class one day and your friend didn't do their homework and they asked to copy yours. What do you do? So that's a decision that the students have to make. Well, it ends up in this particular storyline that you actually get caught. And so what the game actually allows you to do is make bad decisions first, or the not so great ones, see what the results are, the consequences of those, and then you can actually go back in time and change your decisions to see how that outcome would differ from the original one. So as I mentioned, Play Forward has 16 hours of gameplay. It deals with everything from drugs, alcohol, sex, all of that is in there because all of those were found to be related to, those risky behaviors were found to be related to promoting HIV transmission. So we wanted the opportunity to address all of those with this game. And then down at the bottom, kind of like those little colored cards that you see that say me power, refusal power, people sense, priority sense, no sense. Those are the mini games that are interwoven into the main storylines. And the mini games concentrate on specific behaviors that we want the students to walk away from. So walk away from the game with. So for example, with refusal power, a student would learn different ways to say no to peer pressure. It's not enough sometimes to just say no. Sometimes you have to save face if you're in a group with your friends. And so we give them actual skills that they can practice in the context of the game that they can translate into the real world if they're ever in situations or similar to what they might find in the game or other ones. And so this is Play Forward. And so what we did and what we do for all of our games is it's not enough for us to just say, okay, great. Like we have this video game, we've built it out and we think it's great. The kids that worked on it with us think it's great. We actually want to measure it and make sure that the game has efficacy behind it, that it's doing what we say it's going to do. So we use randomized controlled trials, as we mentioned in the introduction video. That's kind of seen as the gold standard for being able to measure these things. So with Play Forward, we enrolled 333 kids. Half of the kids played our game Play Forward, Elm City Stories, over the course of 6 weeks. And then half of the kids played control games like Angry Birds, Temple Run, Subway Surfers, things that kind of keep their attention. But basically all of the kids answered standardized assessments at baseline, 6 weeks, 3 weeks, baseline, 6 weeks, 3 months, 6 months, 12 months, and 24 months. So it was a very long randomized control trial where we were hunting down kids for almost 2 years after they started playing the game, after they finished playing the game, excuse me. And what we wanted to measure was whether playing our game actually delayed the initiation of sexual intercourse and sexual activity within the kids, which again which is directly related to HIV transmission. But we also measured the students' knowledge, attitudes, and intentions in engaging in risky sexual behaviors. So what we were able to find from that particular intervention is that both groups across the board demonstrated low rates of initiating sexual intercourse, which isn't a bad thing. That's actually a good thing. A lot of our students were in controlled like after school programs. Different schools had after school programs. So, you know, that kind of speaks to these students. They have a much more structured environment. And so whether they were in the experimental or control group, they weren't engaging in sexual intercourse. But what we did find is that students who played our game Play Forward actually had better sexual health knowledge when compared to the control group. And then they also had better attitudes towards sexual health when compared to the control group. So jumping into our next game, Smokescreen. Smokescreen is a game that is geared towards smoking and vaping. So Smokescreen has actually had about 5 different funding sources, and the latest is actually CVS Health Foundation. And their goal is to get Smokescreen in the hands of as many students as possible. But as I mentioned, with all of our games, we actually make sure that they undergo some kind of research evaluation to make sure that the games are doing what they said they were going to do. So with Smokescreen, sorry, this is actually like 2 little screenshots from Smokescreen, so you can kind of get a feel from that since I had so many with Play Forward. But with Smokescreen, we actually found that students who played our game versus a control game, sorry, this was not a randomized control trial, but what the students actually did was we tested them before they played the game and after they played the game. And what we found was that after they played the game, their risk of perception of harm for e-cigarettes actually increased, because that's a big thing with vaping. Students are always like, oh, miss, like, that's just like water vapor. That's not the same thing as cigarettes. Like, there's no harm in that. Or if you like try, e-cigarettes, you're not going to get addicted like you hear about all the time with smoking. So we were able to find that with students who played our game. And then also, we also saw negative health beliefs about cigarettes, e-cigarettes, and other tobacco products increase after the students played our game. So again, because we had cigarettes that were addressed in the game, and a lot of times, like, this generation always hears, cigarettes are bad for you. We threw in other tobacco products and e-cigarettes into the game, and we're able to show them that they are just as harmful as regular cigarettes, and why, and sometimes even more harmful than regular cigarettes. So we were really happy to find that through that pre-test, post-test that the students went through, that they actually increased their negative health beliefs regarding e-cigarettes and other tobacco products. And then finally, the third game that we wanted to introduce everyone to today is our game Playtest. And so Playtest is actually a game, again, it's very similar to Play Forward in that we use a lot of the same different methods to elicit feedback from the students. But this particular game was geared towards increasing the use of school-based health centers, getting students to be able to advocate for their own personal health, and then also getting them to get tested for HIV. And so with this particular project, we actually just finished up in October. We were at the tail end of it. COVID hit us and we had to do a little cha-cha to make sure that the project got done. But we are happy to report that we are actually in the process of reviewing the data from that randomized control trial. And with that one, we worked with 5 different schools across the state of Connecticut that had school-based health centers, and enrolled 296 participants to actually either play our game Playtest or play a set of control games. And we were measuring their knowledge, their attitudes, their intentions about HIV and STI testing and counseling, school-based health centers, personal health advocacy. And then also we were working with the school-based health centers to actually see how many students went in and got tested for STIs and HIV. And that's kind of like the big kind of gold star for, our games, which is like behavior change. It's great if we're able to increase students' knowledge. It's great if we're able to change their intentions to do certain things, their attitudes towards certain things. But if we're able to actually influence them to engage in a particular behavior, and with this particular project, go get HIV tested, or go get tested for STIs, that is kind of like our ultimate goal with regards to all of these games. And so here we have some screenshots of like the home screen, and then some scenes from the game Playtest. Playtest is a fairly shorter game than Play Forward. It's about 6 hours of gameplay, but it was geared towards older high school students, 14 to 18 years old. And so that is kind of like the quick and dirty of 3 of our games that are currently available. As Katie mentioned in the beginning of this, all of our games, once they reach the phase of where we've gone through the randomized control trial and the actual research and testing of them, they are put onto our website, and their access is free and available for individuals, for schools, for we've had entire school systems at certain points contact us to get user IDs and logins so that their students can play the game. And to do that, all you have to do is go to playtoprevent.org, or you can email us at playtoprevent@yale.edu. We have a new website that will be coming up in 2 weeks. And so all of the games will be able to be accessed there. But in case you go on the website, like right after this webinar, and you don't see a particular game up there, i.e. playtest, because that is the one we just finished, you can always email us and we'll send you as many user IDs and logins as you need.
Thank you so much, Tyra. If you have questions for Tyra, please be thinking of those now. Continue to keep your mics muted and we'll do our Q&A shortly. First, I'd like to let you know about a few upcoming opportunities regarding the games. As Tyra said, this has been our first webinar in our 3-part series on virtual tools for schools and school-based health centers during the pandemic. We'll have another webinar for providers and school partners on March 24th, focused on our new opioid misuse prevention game, as well as a webinar specifically for youth on April 7th, reviewing all 4 games. So please share that one with any young people you know. Registration information is on this slide, and again, you'll receive a copy of the slides after the webinar. As mentioned, our next webinar will focus on our opioid misuse prevention game, PlaySmart, which is being developed and tested now. We'd love to involve you and your schools and students in the process. If you're located in Connecticut, consider signing up to participate in our randomized control trial, giving your students the opportunity to become game developers and testers this fall. You can contact Tyra for more information on that opportunity, and her email is listed. If you're in other areas of the country, consider joining our nationwide implementation project, which will involve everything from provider focus groups, short-term commitment, to longer-term pilot project implementation at your school-based health centers and schools. Financial incentives may be available. For more information on this project, contact my colleague, Erin Sullivan at School-Based Health Alliance. And again, her email is there. So now I'd like to move on to our interactive Q&A and invite everyone to join in. I'm going to stop sharing my screen in a moment and ask you to turn on your video if possible, just to encourage a more engaging discussion. I have a series of questions, so if you wish to speak, please unmute your mic, or you can type responses in the chat. As always, please stay muted if you're not speaking. So here are the questions that we'll go over today. Again, I'm going to stop sharing my screen in a moment and ask you to turn on your video. We'll repost each question in the chat. If you're unmuted, please mute now unless you wish to speak. So first up, I'd like to take general questions about Tyra's presentation, anything you're wondering about.
Hi, Katie. This is Brittany Couch from Oklahoma. I'm not sharing my screen because I'm cutting in and out a little bit, so I apologize. Tyra, great presentation. I think the feedback from the young people is so awesome and spot on. I love what they said about this, the skinny pants versus the baggy. That's hilarious. But that's just a sidebar. But my question is, I really like all of the feedback from the young people that would be the users. Have you all thought about maybe a little bit down the road? I'm thinking about young people that are in more rural areas, like our state in Oklahoma. We really only have 2 quote unquote major cities, Oklahoma City and Tulsa. But I think also that's also some of the feedback that I could just imagine in my head is that young people that are in more rural areas, they might say that, you know, some of the things that you talked about, like with the feedback they gave about the housing or like the neighborhood, it would look different. I definitely think that they would still be engaged and play the game, but it might, you know, kind of appeal to them more because some of those things just don't exist in those areas, or the layout of their community looks a little bit different. So have you all considered down the road, maybe even possibly coming up with a similar version or some of the same situations, but just some of the visuals look a little bit different.
Great question.
Yeah, thank you for that question. No, that's a great question that we do hear like all the time. And like after we finish like the research aspect of it, we always do have to mention that in like, our peer reviewed papers that, this was developed and created in a specific part of the country. And while there are a lot of similarities of teenagers, there are differences that would be accounted for, just as you mentioned, Brittany. The good news about that is like, again, we're in our 12th year now. We are seeing some opportunities to for our lab to partner with other research institutions, universities, school systems across the country, which is what we are like, as we head into like the second quarter of 2021, what we are really focusing on. We have put in a grant for our game Smokescreen to actually partner with, it would be UNC Chapel Hill, but they actually have school-based health centers in rural North Carolina. And so we recently put in a grant to see if we could modify Smokescreen to actually, with that specific population, that rural population, but then also, update it because, some of these games are 5 years old. And so like things are always changing with the students. And so that's things that we always have to keep at our forefront. But that was a great question because we have thought about that a lot. We do get that question a lot. So when, opportunities for funding do present themselves to be able to do something like that, we definitely jump on them. And even thinking about tailoring some of our games when we think about, like translating some of our games into different languages. If English is not a student's first language, we've thought about like all of those things. Of course, it always comes down to funding sources.
Right. Thank you so much.
I'll just add on to the current game that we'll talk about in the next webinar is pretty much designed already, but there are those opportunities for feedback for both, the short-term provider feedback. So if you're interested, it would be great to connect with Erin to get involved in that national pilot project to give some feedback and involve your young people in what would make sense for them. We'd love that.
Definitely.
Awesome. So I see a couple of questions in the chat. Tyra, is there a way that teachers can track which students complete the game so that they can give them credit or rewards in some way?
Yeah. Yes, that's another great question. So we recently just so the answer to that is right now, no. But we recently just put in another grant to allow us to update our backend system so that teachers are able to do that. So we have heard that question a lot as well. And we do think that it is important, like if a teacher is using it in her classroom or his or her classroom, that they are able to track their students. So we did recently put in a grant. And so we're hoping that that comes through so that we are able to update our backend and give teachers that, that ability to look and see how their students are progressing. From what we understand, a lot of teachers who implement this in their classrooms now, they have students play one level per class or something like that. And that's how they're able to track like, okay, like today kids, we're gonna play level 3. And so, you're able to keep everyone on track that way. But if a student is doing it at home or like, they're flying through it at a different rate than another student, then we're hoping that, this new proposal that we put in will allow us to update our backend so that teachers can actually monitor that.
Hello. I have a question about your upcoming opioid game.
Mm-hmm.
I'm in San Diego County, and we find that street level is the problem today rather than doctors or, they are taking it from their homes too and getting involved. 60% of youth or individuals access opioids from friends or family. But a lot start with marijuana. And around there, we see counterfeit fentanyl pills, and they're killing people left and right. And when you're in with the marijuana street level, those pills are out there too.
Mhm.
Is it going to be addressing that kind of progression?
So we do have different storylines that address like fentanyl, address the fact that if you're using other substances, then you're more likely to misuse opioids. And we are really proud of this new game because in addition to the kids, as we always say, that we interviewed in focus groups and individual interviews, we were actually able to interview providers and then people who had previously had issues with opioid misuse. And so we got a lot of different voices on this game. And so being able to address, just like you're saying, it's not just like, oh, okay, like, you know, I'm becoming addicted to it from a prescription that I got from my doctor, but all of those other ways that these students are being introduced to it, we were able to glean that from them. And the interesting thing is with a lot of these focus groups with the students, when we initially asked them about their exposure to opioids, or if they knew what an opioid was or had ever heard of an opioid, they had heard of opioids, but they initially minimized their exposure. They didn't know the gamut that opioids can run. And so like when after we got to talking to them, they were kind of like, oh, that's an opioid and that's an opioid. Oh, and I know this happens like, you know, at a party, like people will bring like these pills and they'll put them all in a bowl and people will take stuff out. So we learned a lot from the students as well, just about like the different forms that that it takes, but how they're being introduced to it. And just like you said, not the, like very low level traditional way, like, oh, like I had this, from my doctor and now I am addicted to it. But yeah, we do address fentanyl in there. We address the fact that heroin is an opioid. And with this game, we hope to increase the perception of risk of harm that the student has with regards to opioids. So there is a lot of talk about heroin and how that is in the same class as it is an opioid. So getting students to understand that as well.
Thanks, Tyra.
Mhm.
Oh, I see a question from Grace.
Hi, yes, everyone. So I had a question. During the pandemic, have you all seen an uptick in folks reaching out to you for this type of content and resource? So I'm curious if like the pandemic has kind of propelled the work forward, and maybe you all will be getting more funding because now like online teaching and like more online resources are becoming more available. So I had a question if the pandemic had any kind of impact on the amount of folks reaching out for this resource.
Yeah, I think so. What we are able to do whenever people come in and go to our website and request games, we use Salesforce on the back end, so we're actually able to track like how many user IDs are requested, like who's requesting them. And so I would say like during this pandemic we have seen an uptick where sometimes normally we would get requests from particular households, like parents who maybe homeschool their children, requesting one or two user IDs. And now it's kind of like exploded to where we'll get a contact from like, a health teacher who teaches 6 different classes. And so she needs 500 logins for all of her students. So we have seen that. But I think it's been great to see like, stuff coming in from all over the US, because again, this year we are very adamant about like expanding kind of like our brand and our footprint. When we do our randomized controlled trials, it's easier to do them in Connecticut. Like, some of our schools are maybe at most about 45 minutes away from where our office is, but then understanding that this pandemic has given us the opportunity to expand our footprint and our brand to like the entire US. And I've even gotten some international requests. I had someone from Taiwan request some Smokescreen access last week, as a matter of fact. So yeah.
Tyra, we've got several more questions for you. Great questions. So I'm wondering if we want to continue with those questions or move on to our other ones for the group.
I would leave it up to you. If there's some in the chat that we could follow up with afterwards, I'd be happy to do that. Like since we have people's names and stuff, I could particularly like email the answer to their questions if that works. If you would like to move on.
Yep, yeah, and I think that we'll send out an email to everyone with slide and recording access, so we could maybe just include the response to that.
Perfect.
So we will get back to you. I want to move on now to just tapping your brains a little bit for ways that you could see using these games in your school or school-based health center setting.
This is Brittany again from Oklahoma. You just got me really excited. I'm already drafting the email to like all these people that I work with. I work for the state government, our Department of Mental Health. So I'm already drafting emails to like our prevention team, our opioid team, our, everybody in our division. And we have youth and young adult specialists. So I really think I'm over our school-based partnerships. So I really think for our providers, we have wraparound that exists in all 77 counties in the state of Oklahoma. I really think that for our school-based programs where we have embedded mental health staff, they're called behavioral health aides that work in the schools, but they're employed by local providers. I think in our middle and high school schools where they're placed, and we're in about 84 to 100 schools at this point. I think that this would be a great, phenomenal tool for them to use with the young people, because what they're doing is they're not there just for crisis emergencies, but they're also there to provide skill-based development so the young, in a trauma-informed way, so the young people learn how to make healthy decisions, how to self-regulate, and things like this. So I really see this as a tool that they can use in their school-based work. Our mental health providers can use in school-based settings to really work with young people one-on-one, or they could have them to do it as a group, and then kind of have facilitated conversations about like, what did you learn or what stood out to you, so that they can really talk through decision making. So that's how I see it. So I'm very excited, just so you all know. I think this is, all of the tools are.
Thank you so much. We're so excited for you. So I also see a comment in the chat that they could be provided in person. So in the waiting room as patients wait at the school-based health center, or during lunchtime, they could have it available on tablets in the lunchrooms. Love that. Any other ideas for ways you could see this being effective in the school setting?
Hi, I'm Nally Shaheen. I'm a health itinerant teacher in the city of New Haven. And I've been using the Smokescreen game for the last couple of years. It's been great. My students absolutely love it. One of the unique things about my position is that I teach at multiple schools throughout the year. So I see over 700 students per year. And so I reach a lot of students, and my colleagues too, they actually see more students than me. They have more schools than I do. But for the few of us that are our itinerants in the city of New Haven, this has been a great tool for us health teachers. I would like to get more health teachers on board, and obviously get more health teachers involved and getting students involved with the Play to Prevent, because the students really do respond to it. I have had students that come back at me and say, "Can I have another code so I can play again?" So it's really cool. I actually did not know about the other two games, which now I'm really excited about, especially because in 7th grade, we have to do a focus on HIV. And I think when that game is ready, we definitely want to utilize that. I right now have been using the Smokescreen game with just my 7th graders because of the way our curriculum works. 7th grade gets the tobacco talk, but 8th graders do not. But I would like to have something for the 8th graders, maybe healthy relationships or risky situations, that sort of thing. So maybe the Play Forward game might fit that age group really well and fit our curriculum really well. So I just want to encourage everyone, if you are teaching health, PE, whatever, definitely find a way to incorporate these tools into your, I give my students like literally weeks to play. So I don't do that. I don't have the time to do that. I only see my students once a week, so I don't have the time to do it chapter by chapter. So I just choose to give them 4 to 5 weeks to play and make a due date for it. I don't have any way to give them credit for it yet, because I don't know if they was actually doing it or not. But most of them do it, and they talk about we go back and talk about each chapter and what they've gone through, the battle rounds and all that. But I just wanted to mention that just in case anybody was curious how it's responding.
Yeah, thank you so much, Nally, and we really appreciate it. I promise I did not plant Nally. She just volunteered. Yeah. Thank you so much. And I did put, Nally, if you're interested, since you're in Connecticut, I put the randomized control trial info in the chat. We'd love to talk more.
Okay, sure. Thank you.
If you guys have more comments on that, feel free to put them in the chat. I'm going to move to the next question, which is sort of linked. Ways you've implemented something like this before. If you've ever used some virtual tools with students or in your school-based health centers, how has that looked before?
Hi, everyone. I can go. My name is Rosemary. I am the program manager for the School-Based Health Center here in Brooklyn, New York. And we're partnered with the Department of Health New York City Teens Connection program. And we have a, it's a, what do they call it? It's like Making Good Choices video. It's called 17 Days. I don't know if anyone's heard of it before, but we do implement that program, that virtual tool here at the school. And essentially what the video is about, it's like it's sort of like a video game, but it's more of like a movie, and you get to make the decisions as to what happens to the character that you pick. And then towards the end, they kind of get to see what their decisions kind of led to. And then there is sort of like a questionnaire that happens after they've completed it, and they get an incentive as part of joining the program. And so we implement that during our waiting room. So when the student comes in, unfortunately it's only eligible for youth, a female youth. But every time we have any student who's interested, we give it to them either way. They're just not eligible for the incentives, but we have our own, so that we kind of mix that together to make sure that everyone's included into that tool. But then after they've completed it, they kind of get a better sense of why it's important to make healthy decisions, especially around sexual reproductive health. It's really geared towards sexual consent and the importance of that. And then also it actually adds on a condom demonstration area video where the kids get to learn about how to put on a condom correctly. And that's kind of connected into the video. I think the video in itself is about 35 minutes long. They get to pick a character. They have a sort of an introduction. They get to pick a character and then go through the scenes with that character and make the decisions. But that's one of our most effective tools that we use, and we connect that to our contraceptive counseling. So they'll watch that video, and then especially if they're interested in birth control, then we do a little bit of a counseling with them and kind of connected with that video. And it works well because most of our youth who select a contraception kind of keep it and don't sort of switch it because they know exactly what they want. So it's a great program. It's called 17 Days.
Thanks so much, Rosemary. Would you mind putting a link in the chat if you have one, just in case others are interested in that? It's great to hear about all of the different interactive tools we can bring to students these days, especially during a pandemic. I want to move to our next question. I know we're getting close on time. So just in your work with schools and school-based health center collaboration, what are some ways that you get staff and student buy-in to projects like this, or just getting them on board for different projects? And I'll wrap in the next question too. Who are the best at the school to achieve that?
In terms of who to contact for implementation, definitely, at least in New Haven, I would say the department head, our health department head, as well as our curriculum writers too, because even right now in New Haven, we're actively trying to update the health curriculum, get off the old Michigan model and find something that works and that's tailored for New Haven. And so without having to use any too many outside resources that you have to pay thousands and thousands of dollars for. The burden's kind of fallen on us teachers too as well to kind of come together and find some grant money and to kind of get to work on revamping the health curriculum. So part of revamping the health curriculum is definitely incorporating a lot more technology, since the technology is there and it's out there, is to start to incorporate it a little bit more, because let's face it, students do respond to gaming and they love gaming. Even the ones that don't game end up loving gaming. So it is great in some way, and it gets them involved and gets them into that real world problem solving, inquiry based, all that stuff. So I would say definitely go right to the heads.
That's great advice. Thanks so much, Sally. I saw in the chat too, someone said school counselors. I know school counselors and school nurses too can be a great resource. Really working as a team to get these resources to students. So I am going to move on to wrap up. I've got a couple announcements for you guys. Please, if you have other questions or thoughts, we'd love to hear them. I'll share our contact information in just a moment. So, all right. There will be a follow-up survey for attending this webinar. As a reminder, we're offering $10 gift cards to participants if you go try out the games and complete our follow-up survey. So what that would look like is you go to the website, access the games, familiarize yourself with them, and then share them with students. And as you're doing that, really think critically about what we would need to consider to best support providers and schools in delivering these games. And then there's a survey link here, which again will come with the slides when we send them out to follow up. And in that survey, be sure to put your contact info so we can get you your gift card. But we will send reminders about this as well. So we'll send an email after the webinar with recording information, and then we'll also send a reminder in a few weeks. So we sincerely hope you'll try out the games and give us your honest feedback. Thank you to the person that said it would be great to have a mental and emotional health game to help build skills. That is on our radar. We are looking for grant money as we speak. So let us know if you see anything. But yeah, definitely on the radar. Suicide prevention, mental health. Yes, absolutely.
And just jumping in really quickly here, Katie, like even our foray with the opioid use prevention game, we have included some emotional and mental health storylines in there. So we're on it.
Thank you, Tyra. Yes, we did. Awesome. We'll get to some more, we'll respond to some of these chat questions afterwards. I want to give you a couple more announcements as we wrap up. Some general opportunities from School-Based Health Alliance and Play to Prevent. The Alliance is hosting a summer education series. So some information about that is on the screen, and again, will be included in the slides. We'd love to have you join us this spring and summer. We do a lot of youth development work at the Alliance. So if you'd like to sign up for our digest or offer submissions, or complete our survey to kind of share your youth development work, we'd love to see that. There's also an upcoming webinar put on by our Youth Advisory Council on utilizing media to talk about unhealthy relationships with young people. And we'll again have our Be the Change Youth Leadership Training Program this summer virtually. So would be a great opportunity for any young people you know. And there are some open positions at the Play to Prevent Lab. So if you know any high schoolers interested in internships, or undergraduate, graduate, and postdoc students, there are internships as well as paid positions. So please check those out. And here are our contact emails. You can get a hold of me at the Alliance, Tyra at Yale, and then again, we'll send out the slides if you want to reach out to other folks regarding some of the other opportunities. Thank you all so much for joining us today. Again, please get in touch. We'd love to hear more from you.